Hello there, Ken Cook here, and I'm having another episode. You know, ever since Robert F. Kennedy Jr. was confirmed as Secretary of Health and Human Services, and specifically during his confirmation process, I've been keeping a close eye on the dismantling of our vaccine policy infrastructure. I suspect a lot of you have been keeping an eye on it too. It's one of the top priorities of the public health community now. And I've come to think of the approach that he's taken. I've coined a term for it. I call it vaccination. This is why he's able to make the case, on the one hand, to his anti-vax followers that he's doing all he can to pursue their agenda, and that agenda is to prove various things about vaccines being harmful, even maybe more harmful than the diseases they prevent, that vaccines cause autism, and so forth. And he always does it in a kind of vacillating way where science is never settled, so we can always ask questions. A gold standard science is needed, and he's bringing that because you can't rely on existing authorities. And most importantly of all, he's not wanting to be positioned as either anti-vaccine or supporting vaccine. He's in that vacillating middle ground. And that has worked for him surprisingly well. It didn't work for Casey Means. Ultimately, she got caught up by not really saying what she thought when she was rejected by the Senate in the confirmation process for becoming Surgeon General. But for Kennedy, it has mostly worked. But there's one arena where it does not work, not the arena of hearings where Kennedy gives and takes with senators, not press statements, not podcasts, not Instagram posts. In all of those places, vaccination has been a very smart strategy for him to remain elusive about where he is, even as he pursues anti-vaccine measures. But the one place where it doesn't work is in court, in legal proceedings before a judge. And today I'm joined by a lawyer who's doing something about vaccination. Richard H. Hughes IV, who is a partner at Epstein Becker Green, a health law professor at the George Washington University Law School, and the lead counsel in American Academy of Pediatrics versus Robert F. Kennedy Jr. This was a landmark lawsuit challenging the vaccine policy changes Kennedy has implemented at HHS. And in that setting, there is no wiggle room afforded for vaccinating. You have to follow the law. Now, Richard's clients have included some of the most respected medical organizations in the country: the American Academy of Pediatrics, the American College of Physicians, the American Public Health Association, the Infectious Disease Society of America, among others. And in March, a federal judge looked at all this vaccinating and specifically the steps Kennedy had taken under the cover of vaccinating and handed these organizations a very significant early victory, ruling that HHS had acted arbitrarily, ignored established law, and failed to follow basic administrative process. But the fight is far from over. Richard is one of the nation's leading experts in vaccine law, and he has spent his career building the very public health infrastructure that's now under attack. I'm grateful that he's here because he, like EWG, follows science, and his objective is very clear: to protect the health of America's children and their future. Professor Hughes, thank you so much for being here. The stakes could not be higher, and knock on wood, at least from my perspective, and I'm sure yours, so far it looks like it's gone pretty well, but we've got quite a ways to go, no question about that. I just wanted to ask, how did you, as you were starting your career, what brought you, Richard, into the health arena, and specifically this subset of health pertaining to vaccines? If you don't mind, I'm just curious to know.
I don't mind. Yeah, no, Ken, I appreciate that question. It actually goes, and thank you for having me. It goes so far back, long before I was a lawyer. I was a very young political appointee in my home state of Arkansas. So I was 22 years old, and I was appointed to the Arkansas State Board of Health. And I didn't know anything about public health. I was incredibly unqualified. It was an undeserved privilege to get that appointment. And right after I was appointed, I survived a brain tumor.
Oh, my goodness.
Yeah, I was misdiagnosed with glioblastoma. It was basically a death sentence, and got a second opinion and found out that I was going to live, and got involved in cancer issues. And I said, I'm in this position. and I can do something, to improve the health of our Kansans, I felt compelled to do that. And I learned about the HPV vaccine. So a colleague came to me one day and said, there's this vaccine to prevent cervical cancer. And I didn't know anything
Yeah.
about it. But as I dug into it, as I learned more about it, I said, we really need to talk about this vaccine, and we really need to make this vaccine accessible. Now, at the time, this was before the Affordable Care Act. We had a lot of access issues in our state. And I knew that if we were going to reach the most rural parts of the state, that we should consider requiring the vaccine. That was a really unpopular opinion to
Yeah.
have.
Yeah.
It got me kicked out of party politics. It ended my political ambitions completely. And so I got my master's in public health. I moved to DC. I said, I'm going to work in vaccine policy for the rest of my career. I went back to law school and, added a lot
Wow.
more tools to my toolbox.
Wow, I had no idea there were so many layers to that, to your history. And just as an editorial note to start off with, Environmental Working Group has, we generally speaking have always supported vaccine policy, the conventional policy that is now at least temporarily back in place, and the CDC's positions on all of those things. We did raise questions about thimerosal back in the day, but those were resolved. But
Yeah.
generally speaking, on vaccine policy, my overall feeling is the environmental health community looked the other way on the vaccine debate, which was probably not helpful. I think we now find ourselves in a situation where there is such a threat to that frontline defense and so much energy around undoing the reputation of the CDC and of science and of practicing physicians. I read some of the things people say about pediatricians, and I wonder what pediatricians are they talking about?
Yeah.
Everyone I've ever met, and I've met hundreds of them because we work on children's environmental health all the time, and from my own experience having a son, I don't get it. But anyway, I wanted to put that out there because a big part of this is the kind of atmospherics that drove you away from the job in Arkansas, right? I mean, you must feel that in your current role as well, right?
I absolutely do. I absolutely do. And it was really hard to watch the distortion around vaccine science. And a lot of that was wrapped up in religion back in Arkansas, right? And,
Right, of course.
talking about abstinence and sex, and that was unfortunate. But I feel like, we're up against a lot of the same issues, a willingness to spread misinformation and disinformation so easily, a public that maybe at first glance, sometimes, you might see something that looks like a potential correlative relationship, and you might have real questions. And I do think that we should be answering those questions and helping
Yeah.
people understand the science, right? But
Yeah.
it's really hard to, sometimes get people off of these beliefs, these misguided beliefs, when you have somebody like Robert F. Kennedy Jr. with the bully pulpit now, right? Spreading all this misinformation.
Yeah, no, and of course there's conspiracy-minded approaches to these issues. It's very convenient and very hard to overcome. It's a great retreat from critical thinking.
Yes, it is.
Right, and that's done a lot of harm. I found myself when I read the judge's decision in March, I was fortified by that, not just because of the way the decision came down, but the learned way in which he argued it. And I just want to say, just from the beginning of his order, he writes that for our public health, Congress and the executive have built over decades an apparatus that marries the rigors of science with the execution and force of the United States government. One extraordinary product of that apparatus has been the eradication and reduction of certain communicable diseases through the development and use of vaccines. And right there, he's drawing a distinction in his position, his conclusions from Kennedy's, which increasingly is to argue that these vaccines didn't play any role. And so the whole presence of the government in this sphere is questionable because, better nutrition and sanitation and other measures, really that's what caused polio and mumps and other diseases to be controlled. Patently not the case, but I appreciated that he was standing up right then.
Yeah, I did too. I love that decision. It reads beautifully. I love that on the first page, he intertwines science and law and talks about the importance of process to both. This is the first case I've worked on as a litigator. I'm not a litigator. I didn't go to law school to sue anybody. It is. And sitting in the courtroom, sitting in the courtroom as a vaccine law expert at the counsel table, and really just hoping that we are doing the best possible job to help the judge get the facts right, to get the law right, to make the best, most informed decision, because we want the decision to stand. He
Yeah.
wants to write an effective decision. He wants to get it right. He's not an ideologue. And, the government over here is saying in the courtroom that, there's no binding, guiding principles in the law that says the secretary has to do this or that the secretary can just basically do whatever he wants, and that reasonable minds can differ on how to best prevent infectious disease, and that we're all here to protect public health. It was really disturbing to hear some of those arguments and the way they framed it, and that it was so encouraging to hear the judge come back to them and to recite back to them law, and to see how he followed the apparatus that he described. And it has, I mean, I have to say, there was a time when all we had were vaccines, and we didn't put policy or the force of law behind them. Sometimes then we would do that in an outbreak context. So late 1800s smallpox
Yeah.
outbreaks, we're saying you
Yeah.
have to go get vaccinated because we're trying to prevent it. But one of the greatest innovations in the law and in vaccine law and policy in the 20th century was we realized if we can just get everybody vaccinated early, we can actually stop the transmission of these diseases. We can lower the overall incidence of disease, the overall morbidity and mortality. And we started to do that in a really systematic way with vaccine policy. And as the judge recited, we have these federal laws. The federal government is not making people get vaccines. That's the role of the states. But there is a robust apparatus in federal law that says, Congress has thought about this, and they've enacted a variety of laws
Yeah.
where we essentially presuppose that vaccination is the best way to control vaccine preventable diseases in this country.
Yeah.
And that's simply what we're trying to do.
Yeah. I was astonished at some of when the judge asked certain questions about, well, how far could Secretary Kennedy go? How much power does he have? Could he actually say, getting some of these diseases is okay or is good, or we would like to pursue policies that would encourage them to get these, which of
Right.
course Aaron Seary and others,
Right.
Dale Bigtree, have
Right.
openly said they think that should be the case. I was astonished. What was it like in the
Yeah.
courtroom when you were hearing that?
Well, what's really hard is when you're, I speak a lot on these issues publicly, right? I'm a policy oriented lawyer, and I have opinions, and to sit in the courtroom at the counsel table and to really, you have to maintain decorum in the courtroom. It's not a raucous place, right?
Right,
And
right.
and so to have to sit and listen and keep a straight face to those kinds of arguments was really, really, really hard for me. And the number of things that you wish you could say, right? And so for the judge to point that out, and to use that example, and I think it's one of the great things that judges sometimes do, is to present absurd hypotheticals. And it was a really,
Yeah.
really, really effective one. And so I think what gets overlooked is they frame up natural infection as just fine, that natural infection is just fine. And what in reality is, if you go to old graveyards and you look at the number of infant graves that are there, and these graveyards are all over our country, right? In the early 20th, late
Of
19th
course.
century, early 20th century, right? And then I always go back, I tell my team all the time about this letter to the editor that I read around 1994 and 1995 in the New York Times, where a mother wrote to the New York Times and she said, I just learned about this new vaccine to prevent chickenpox. And I don't understand why I wasn't made aware of this 5 years ago when the vaccine first became available. Because she said, to my family, chickenpox is not a minor illness. Chickenpox had devastated her household. Her kids ended up with all sorts of infections that I didn't even realize that, measles, chickenpox, these things can result in other infections, other morbidities,
Very serious. Yeah.
right? Very serious, and sometimes very deadly. And so, vaccination is a way not just to prevent cases and to have fewer or hopefully zero cases. We have a sophisticated tool. People don't have to die from these diseases. They don't have to deal with the long-term effects of these diseases.
And the consequence of not intervening through vaccines on the cost of the healthcare system, and I've even said to some of
Yes.
my colleagues in the environmental community, we all noticed what happened during COVID, where all the resources rushed from the CDC and
Yes.
elsewhere, rushed
Yes.
straight to the concerns and the need to adapt to the COVID conditions. You lose a lot of ability to do other health related interventions, including environmental health and talking about pollution or contamination of food or what have you,
Yes. Yeah.
that contracts in the face of emergencies, which has a
Yes.
huge impact.
Yes.
I noticed, and I want to mention the other plaintiffs because it's an impressive list. It's the American Academy of Pediatrics, the lead plaintiff, but it's also the American College of Physicians, the APHA, the American Public Health Association. We also have a longstanding association with them. Infectious Diseases Society of America, Society for Maternal and Fetal Medicine, the Massachusetts Public Health Alliance, and I'm sure there are others
Yes.
that I'm not naming. It's impressive to me, and I've said this to several people. You know, when you look at the way these interests are arrayed on the two sides of this issue, it's kind of shocking to think that there is virtually no reputable, independent science association or organization that stands with Kennedy. Now, I think everyone agrees, yes, there can be vaccine injuries, and yes, we should address those. We should be concerned about those. And unfortunately, sometimes they're, fortunately, very rarely, but sometimes they
Yes.
are serious.
Yes. Yeah.
No question about that. But on the basic question of whether we need vaccines, where any kind of mandate, again, at the state level, which is where these are proffered, it really is shocking that we're at the state of the debate that we're at. And even to the point where I noticed that quite a bit of time was spent by the government to try and make the case that the plaintiffs you represent shouldn't have had standing.
Right.
The-
Right.
Can you talk a little bit about that?
Yeah, I sure
mean, why
can.
not try it? Why not try
Right.
it? You know,
I sure can. And I'm very honest. I'm very honest and open about how we got to this point. We knew when Robert F. Kennedy Jr. came into office that he was going to do a lot of these things. I knew he was
Yeah.
going to do a lot of these things because I've helped build up the system that he's trying to tear down. And so I looked around me and I said to my team, I said, he's going to do these things and we have to be prepared. We have to watch everything he does. We have to watch when he takes these actions, and we're going to need to be prepared to put up a legal fight. Okay, so we have a policy disagreement. Absolutely, we do. The government wants to suggest that that's all we have, and that policy disputes don't belong in court and they belong in the legislature and all that. But there are real harms here. And I would not have pursued this and put my name and resources and effort behind this if I thought it was a mere policy disagreement. I knew that this was going to harm not only public health and families, but that it was actually going to harm the organizations that we're representing. And they do have standing. And so if you look at the pediatricians of this country represented by AAP, not only has AAP itself as an organization had to divert all of its time and resources to deal with this, but the providers on the front lines, and they'll say, oh, it's just, they make a lot of money. It is so not true. Being a pediatrician is not some sort of gangbusters, business to be in.
Yeah.
It's very costly to maintain an inventory of vaccines in those practices. And the reimbursement, it's not usually profitable. And so this is causing them, the frustrating experience of having to address misinformation and disinformation that their patients are hearing, coming in confused, and to practice effective medicine. That's been frustrated. And the same thing, American Public Health Association and Dr. Benjamin doesn't mind me telling folks that when I called him and I said, would you be a part of this? He said, we're in. It was a no-brainer because he and I we instinctively knew that this was going to impact health departments across the country. There are clinical practitioners that are members of the American Public Health Association. They represent this vast constituency across the country of public health workers, clinical workers, all kinds of folks. And we knew that the harm was going to just permeate the public health system. And so we demonstrated those harms. We're proud to represent these plaintiffs, and we take very seriously the work of showing the court that they have been harmed. And we did that. We went in December. The government tried to get our case dismissed on standing. And we went in and we, demonstrated to the court they're experiencing real harms. And if anybody's interested, go read the declarations that have been filed by the dozens of physicians and others in the case.
Yeah, I encourage people, to read the whole record so far.
Yeah,
Every aspect of it is, to me, informative, up to and including the judge's order in mid-March. Kennedy's often claims that pediatricians are in the pocket of big pharma, as you suggested, and it's very profitable to give kids shots, and they make a lot of money doing it. Sometimes I've seen it suggested that this is the main way they make money is by vaccines. I haven't seen any evidence of that. But what interests me is that in order for his approach to work, he has to then say, we want you to have a conversation with your doctor before you decide for yourself about getting vaccinated. So where do all the good doctors go, and where do all the bad doctors go that you can just... And it turns out that if it's your pediatrician, that's a good doctor. But when they gather together under the Academy of Pediatrics, or when they assemble, that's when they're evil.
Yeah.
It makes no sense.
Yeah, no, it doesn't. It doesn't. It doesn't. And there are fringe, very, 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 very fringe physicians out there that are a part of his movement, right? And I'm sure that's who they would rather you go to and talk to. But they want to frame this because these are political issues, right? And they know Robert F. Kennedy Jr. has a base and a constituency that he is pandering to. And when they talk about medical freedom and choice and forced medical treatment, this is also deceptive. And so if you go back, the old case, Jacobson v. Massachusetts, 1905, the Supreme Court said states can require vaccination. There's a lot of really great discussion in that case. It's a dense read. I have my class read it every year, but it talks about sorting junk science from evidence, in early 20th century terms. And by the end of the decision, it talks about the importance that we not make people who shouldn't be vaccinated get vaccinated. It acknowledges that. That is in the opinion.
Yeah.
So inherent, when I think about vaccine policy and I think about requiring vaccines so that people can be healthy and we save lives, what I know as a part of that equation is that it's always going to be a conversation between the pediatrician and the parent about the child's health. And they should sit down and they should say, which vaccines do we need to get? Well, we have this schedule and it's standardized and it's based on evidence and we should follow it. But if this child's contraindicated, if they're at risk of some sort of harm that is ascertainable, then we shouldn't vaccinate. But those cases are rare. Those cases are rare. And we should acknowledge when there are rare vaccine injuries, we need to compensate those. We need to do it quickly and adequately so that we can continue to pursue the public health goal. I ask my class every year, would you rather have 100 cases of polio or would you rather have, 2 injuries? And, we have to make some trade-offs. And there's a social compact here that they misconstrue, that they absolutely misconstrue.
Yeah, no, I think that's right. And it's hard to think of a medicine or a drug that doesn't have those kinds of potential complications for some subset of the population, these side effects. I mean, even cancer drugs sometimes cause cancer. So it is a conversation with physicians. And to me, what I worry about is this debate is missing how to actually make parents better consumers of information and make them more able to have those conversations. You don't have a lot of time often in those offices, but how to make the most of those conversations, because that's certainly going to be in the interest of the physician treating you as well.
That's right.
So one of the things that I had all kinds of thoughts about which direction Kennedy might take vaccine policy. I did not foresee him going immediately in the face of what he promised Congress and firing every member of the committee and replacing them summarily with his own people. But it goes to a question that I've had, which is, I thought in this second Trump administration, they were being more careful than in the first Trump administration, certainly in environmental decision-making, where they made it easy to lose in court. And they mostly did lose to my colleagues in the environmental community who practice public interest law, so law that sues the government. But then as I read this judge's decision and saw what was piling up, I was shocked at the fumbles, the mistakes that HHS made with the Administrative Procedure Act, that you made great use of that law to point out to the judge, and he ruled, I think, in every instance on your side. That's there for a purpose too, in addition to vaccine law, which is, it's to make sure that the government proceeds in an orderly manner. It's not arbitrary. It's not capricious. And the thing that puzzled me the most, Richard, was, if you're an environmental lawyer, the Administrative Procedure Act is central to how
It
you
is.
think about challenging the
It
government,
is.
maybe more than almost any other area
Yes.
of
Yes.
public interest law, right? Because it's the clockworks of
Yeah.
EPA and Interior
Yeah.
Department and Fish and Wildlife Service. And
Yes.
when they get a procedure wrong, when they're arbitrary, when they're capricious, when they make a decision, in favor of industry that is ill-considered, that's where the environmental community and Kennedy in the past has grabbed on.
Yeah.
I was surprised that there were so many mistakes that there in the rush to get these decisions made, which to me tells me also that they're not likely to be lasting. But I'll go back to that. But just
Yeah.
talk a little bit
Yeah.
about the
Yeah.
Administrative Procedure Act and how you saw that
Yeah.
play in this case.
You don't even need to take a law school administrative law class to see that. I mean, it is so just patently obvious. I said early on, I said, anything this man does is going to be arbitrary and capricious because the science isn't there. The science doesn't support it. They're not going to be able to point to anything legitimate and to say that's the basis for this decision. Now, what I didn't expect was the lack of process. The explanation part of it, and these are all, I'm talking about sort of the recipe of what we expect government officials to follow, right? We expect them to take a hard look at evidence. We expect them to follow a process, to explain why they did it. I knew that they wouldn't find the evidence. I did think that they would at least try to give the appearance that they were following a process and taking a hard look. The way they throw around the terms gold standard science and transparency and everything, I think it's very misleading, and I didn't expect a lot of explanation or transparency. But I really did think that they would try to follow some process.
So did I.
Right? And so for a long time, environmental lawyer who, as you said, should have a deep understanding of the importance of the APA and procedure, to just go out one day and film a video and in 58 seconds make statements like the previous administration's recommendations were based on nothing, right? And to say that I'm standing here, a lawyer surrounded by two other political appointees, I'm just going to tell you that I'm delighted. In fact, I'm going to use the word delighted to tell you that you no longer need to get the COVID vaccine. I mean, it just reeked. It reeked of lack of process, of unseriousness. And same thing with the January 5th schedule changes. And as President Trump is saying, well, let's look at the Danish schedule. I think there was actual reporting that HHS knew that what they were discussing would likely violate or potentially violate the APA. So they know this. And I think that this is just evidence of Robert F. Kennedy Jr. and the forces around him will stop at nothing, to get their agenda through.
Yeah. I mean, what I've been saying to my friends on the other side of this issue is if you really did believe that you wanted to tear down vaccine policy in this country and do it on the basis of transparency and gold standard science, you've been failed by Kennedy. Yeah. The pace at which he's operated, the fact that, I mean, here he has control over all these funds. He could launch the study that he says we've long not done to link vaccine harm to, autism or whatever it might be. I mean, you've got all the money now. You could control it. Where are the studies? Where is the evidence that you're putting forward, or what basis? And then you have a press conference in the White House about Tylenol and the promise that by September of 2025, we'll know what causes autism. So obviously these aren't serious people. They don't show their work. Anti-vax interests, anti-vax proponents ought to begin to understand by now that these changes are not going to endure. They're not going to stand up scientifically. And as we see in the case that you've been arguing, it's not standing up in the law either.
No.
And the political support seems to be eroding. At least Republicans want to talk about healthy eating, not vaccine policy anymore. It's a real shortcoming of Kennedy's approach, but I think it's what he's left with because the evidence really isn't there.
Yeah. It's not. And ultimately, we're going to prevail. We have to litigate this thing. And it's unfortunate, but I knew that if he did these things and if we were going to stop him and show to be true what you just said, is that they're not showing their work. This is all false. And we need to stop it. And we need to go back to, and it's not to say that our system before couldn't use improvements. Absolutely, it needs improvements. But, if we were ever going to stop this and restore sanity, we were going to have to sue. And we still have the work to do. We're not done yet, right? But ultimately, yes, it won't endure. It won't endure because we're stopping it.
Yeah. Now, let me just ask you, Kennedy in recent weeks, and I don't know exactly where this stands now, so help me out here. He has proposed a restructuring of the Advisory Committee on Immunization Practices, the ACIP committee at the CDC, to restructure it to include the kinds of personnel that he thinks will represent vaccine-injured people. I was surprised the judge actually went as far as he went in kind of going through the list of people appointed to this committee and basically saying, this committee can't continue. It doesn't meet the tests of the law for expertise. So how do you see this latest move by Kennedy to reorient the committee and give it a different charter?
So they are trying to circumvent the judge's ruling.
Patently.
Yeah. I hope the White House is watching. I hope that White House Chief of Staff Susie Wiles is listening to this podcast. And I assume that she wanted him to cool it on vaccines because that's not a popular issue, right? Going into the midterms, I don't think they want him to continue this. Now, what they've done is they've gotten really creative. They said, the charter is going to expire on April 1st. And so they got together, and Aaron Series said, we're going to put in a petition and we're going to just change the charter. So, and Del Bigtree has been on his podcast, and there was a Politico story that ran last week where he said, Kennedy basically just has to change the T's he's crossing and the I's that he's dotting. Wow. You talk about transparency. I mean, they're being so transparent about their nefarious, right?
Finally, some useful transparency.
Right. Very useful, because it's like, okay, you broke the rules and you got your hands slapped. And so now you're just going to change the rules? Well, I'm sorry. You have to follow some rules to change the rules. And it goes back actually to where we started in this conversation too, is that the law presupposes we want to use vaccines, right, to control vaccine preventable disease. There is that thoughtful apparatus that's been set up. They are flying. They continue to fly in the face of that. And so, we'll see what he does. We need to see how he would execute on these charter changes. But it's just egregious, and I hope it gets the attention that it deserves.
Yeah, I do too. Well, we'll certainly try and help as much as we can to shine a light on that, because there's never been a more opaque administration when it comes to decision making, and more arbitrary, almost clownishly so, oftentimes to deadly effect. Lots of bad decisions on environmental policy that are causing harm. And we see from the shifting attitudes, the new poll that came out from Politico, that it seems like more and more Americans, are Republicans in particular, are vaccine skeptical and might decide not to have their kids vaccinated because of this ambient debate or discussion. Debate's hard to say. It doesn't really suit it. What are the next steps that will unfold? They haven't formally appealed yet, have they?
They haven't, and they don't have a window to appeal. There have been statements made out of HHS that they have, 60 days following the ruling. This was an interlocutory decision. They had 10 days. They would have had to have a question of law certified to be able to take it up to the First Circuit on appeal. They have missed their window. And so if they want to try to appeal this late, we would oppose that. And so where we are right now is in a relatively boring place where we essentially are working with the government to get the administrative record. And, going back to the APA, because this is an APA case, we are entitled to see the record. And there are different records for each of the decisions, right? And so it's the very boring part of litigation of trying to get the documents. Now, are they going to give us all of the documents we want? Are we going to see the emails and the text messages? We're looking.
I would love to. I would as well. I would as well. So, once we have that record and once it's completed, we'll be pursuing a final judgment and to get a final decision on the merits. And presumably that could be appealed in the future. I would assume they want that to happen after the midterms because of the way we've talked about this. But we're doing the work of getting to that final decision. Well, I want to thank you for that work, and thank you for your time, Richard. I've read deeply into the court record here. I encourage everyone to do the same, and I know your students will be reading through it.
Yes, they have. They have already been. Yes.
I'm sure this is a pretty exciting time to be reading through something as a curriculum that's so present in the world and that their professor is so heavily involved in. And I'm not happy that you had to leave your political career in Arkansas, but I'm grateful in a way that where you ended up is
Me too.
Making this case. These organizations, again, they're not perfect. The law is not perfect. The science is not perfect. But in the scheme of things, we cannot afford this area of law and policy and science to be degraded in the way it is. And that's one of my greatest regrets. People worry about authoritarianism. I get that. But I think well before we get to that, it's the corrosion in understanding what authority really means, the authority of knowledge and expertise, as well as the authority of law. To me, that's the greater threat right now, because that sits in a parent's head.
Yeah.
Who do I trust?
I agree.
If it's a pediatrician of the sort that Kennedy caricatures as in the pocket of big pharma, why would you trust them? On the other hand, you have a kid that really will be vulnerable. Look at what's happened with all these infectious diseases just in the past year and a half. It's very worrisome.
No, it absolutely is. And we have so much work to do to actually reestablish trust. He talks about reestablishing trust. I'm not saying that we were ever perfect at communicating about vaccines. I think there are so many things that we could do better when it comes to talking with parents, right? You know?
I agree. The fact that they feel ghosted is really upsetting to me.
It is.
People say that to me on, on direct messaging and on, LinkedIn and other ways I communicate, that I even question Kennedy, and we came out against his confirmation. And George Benjamin, when I called him, he said, I'm in, when we were live streaming the confirmation hearings. It's like no brainer.
Yeah.
And there's no one in the nonprofit environmental community who's standing up with Kennedy, which is also noteworthy. I say that to a lot of my friends who are, MAHA fans and adherents, that take note of that.
Yeah.
It's kind of noteworthy that you don't have anyone in the major environmental groups that he worked with who's willing to stand up for him. Quite the contrary. So anyway.
That's right.
Well, thank you so much. I really appreciate it. As this evolves, I hope I can get you back on if there's some important developments.
Please.
Really great. Thanks so much, Counselor.
Thank you so much. Thank you, Ken.
Thank you to Professor Richard Hughes for joining me today, and thank you out there for listening. If you'd like to learn more, be sure to check out our show notes for additional links so you can take a deeper dive into today's discussion. Make sure to follow our show on Instagram at Ken Cook's Podcast, and if you're interested in learning more about EWG, head on over to ewg.org or check out the EWG Instagram account at Environmental Working Group. Now, if this episode resonated with you or you think someone you know would benefit from it, send it along. The best way to make positive change is to start as a community with your community. Today's episode was produced by the extraordinary Beth Rowe and Mary Kelly, who wrote that last sentence. Our show's theme music is by Moby. Thank you, Moby. And thanks again to all of you for listening.